Well, good afternoon. A couple of months back, in fact, on June 1st, we announced with some urgency our concerns about what was happening in Imperial County, California. The county had experienced a significant rise in number of transmissions related to COVID-19. Concern was made more paramount as it relates to the overwhelming situation for the hospital system, not only in the ICUs, but the ability to provide for emergency care more broadly, diversion rates for ambulances, health care personnel questions, a lot of stress that was placed because of this pandemic on the county. On June 1st, we committed to a new process, a new protocol to help support the county in their efforts. Began the process of decompressing their hospital system. Over 650 patients were moved out of Imperial County hospitals into surrounding and neighboring communities. And in some instances, we even brought patients here into Northern California. We approached our strategy in the county more as a strike team, more as a unified command approach, something you would see more traditionally as it relates to how we organize and construct our approach to dealing with other emergencies like wildfires and the like. That process took shape again in the beginning of June at a time when we had transmission rates, positivity rates north of 30% in Imperial County. In fact, it peaked at 30.3%. You can see on this graph the number of cases reflected in Imperial County in the blue line, substantially outpacing the number of cases in the rest of the state. This graph certainly presents itself as a spike in cases in Imperial County. It required a new approach, new strategies, and new accountability structures, and that's exactly what took place. The model now, as we're referring to it, the Imperial model, was all about providing supports, building capacity at the local level, filling in gaps, meeting needs both on personal protective gear, not just personnel, meeting the needs of the hospital system, providing additional supports, new strategies and prevention from PSA campaigns, culturally competent messages that were delivered to individuals as well as businesses and more broadly the community at large. In addition to sectoral closures that we made abundantly clear as it relates to moving forward to address the concerns that were flaring up in certain sectors of the economy in the Valley. You can see on this slide the number of cases as they began to spike. We began to intervene. So you can see the medical personnel that we began to send in around June 3rd. Where we worked with not only state and county and local officials, but broadened that support by getting a lot of federal supports as well from a number of federal agencies. You can see after those interventions were put into place, again, beginning with the decompression of the hospital system as a foundational principle, more targeted supports, and some additional sectoral changes as it relates to returning to a stay-at-home order. You can see that line spiked and substantially began its decline. 30.3%, yesterday's positivity rate, still high, but at 11.2%. A successful approach, one that requires constant vigilance, one that we're continuing to engage in, but one that long-windedly has now become a model in terms of our approach, the Imperial approach, in other parts of the state. Last week, where we last joined each other, I began the process of announcing strategies in the Central Valley, in 8 counties in the Central Valley, for the obvious reason you can see exampled here on this chart. We're starting to see not only an increase in the positivity rates. I mentioned last week where I made some announcements about our interventions in Central Valley, that we saw positivity rates on the lower end in Fresno at the time at 10.7%. And peaking around Tulare at a 17.7% rate. Not where we were in Imperial, but we don't want to see it go to where Imperial went. And that's why we felt it was appropriate to intervene using the information, using the experience, the best practice, the data collection, the approach in Imperial, and beginning that approach in the Central Valley. Why the Central Valley? Well, again, this slide underscores the concerns. You're starting to see the hospitalization and ICU rates increase, not just positivity rates in the Valley, outpacing the rest of California. And if you ask me today, what our biggest area of concern in a state as large as ours, it is indeed the Central Valley. We're seeing stabilization in other parts of the state. You'll see some declines in a moment when I make presentation, including some stabilization and some modest declines in Southern California. The Central Valley, again, reinforced by this slide, reinforced by our presentation in Stockton last week, in our announcement last week, is indeed the area of our most important targeted interventions.